Welcome, Doctor.
Thank you, sir. Yep. So I'm looking forward to sharing like how my journey has been in Singapore so far. And I always, I'm very passionate about Ayurveda and I see so much scope of it, especially like when you see people suffering and when they don't even know about such a great science that can help them. So it always makes me passionate to bring Ayurveda to a global platform so people recognize it more and more, just like they have done with yoga. And I'm just praying that it also becomes as huge as yoga and as widely accepted around the world as yoga has become.
If somebody wants to go to Singapore and wants to practice Ayurveda and yoga, what he should do?
Okay, so if you would like, I can just share a little bit of a presentation with you and along
Sure.
with my words. So I hope everyone is comfortable with just as I don't think I'm able to share the presentation
Jayashree?
through the Apple,
No, definitely. Apple.
the Safari, yeah. So that's fine. So I moved to Singapore in year 2016 and I've been fortunate to meet many practitioners over here. And since 2016, what I have noted is there is a upward trend in acceptance of Ayurveda over here. Initially, I would face the problem that whenever I would tell people that I'm an Ayurveda doctor, so let alone be doctor, I would get the question of what is Ayurveda. So my simple way of explaining them would be that just like there is traditional Chinese medicine and every country has the indigenous system of medicine, we have a great system in India, and India being one of the most ancient countries in the world, Ayurveda is the science that has been in India for thousands of years, and that is where I have that is the stream in which I have become a doctor. So then there would be a surprise on many people's faces, can you be a doctor in Ayurveda? What do you study in that? So then I would go ahead and explain to them that, okay, we study all the subjects that the modern medicine or the conventional medicine doctor does, like anatomy, physiology. And not only that, along with that, we study the Ayurvedic anatomy and physiology as well as many more aspects of the body that are still being unraveled by the conventional medicine. But since then, one good thing is High Commission of India over here has been very active in promoting Ayurveda. So there have been the international Ayurveda workshops being organized over here. High Commission of India, along with the Ayurvedic Professionals of Singapore Association, have been organizing the annual meetup for the doctors and the patients of Ayurveda as well as Siddha to promote Ayurveda more and more in Singapore. Another good thing is their High Commission of India over here has been trying to sign up the Memorandum of Understanding so that Ayurveda can also gain the same recognition that the traditional Chinese medicine has in Singapore. Like over here, traditional Chinese medicine can be practiced uh, can be practiced clinically. Whereas the problem with Ayurvedic doctors is that we do not get recognized as Ayurved doctors. We can call ourselves Ayurved therapists or consultants or practitioners, but if I'm practicing in Singapore, I cannot use Dr. Maitri Nagar. I am just Ayurvedic practitioner. And secondly, BAMS is not that widely known. So there are many practitioners who have gained that knowledge either from the generations before them, or who have gained the knowledge via yoga, like with their practice of yoga, and that's what they have been practicing in Singapore. So whether I am a Ayurveda doctor or I just have the basic knowledge of Ayurveda, you can find all types of practitioners over here. So I would like to widely divide the practice of Ayurveda into three things. Like, one would be that people coming into Ayurveda just for the general things like improving their immunity, improving the quality of their health, living healthy lifestyle, getting rid of simple disorders such as chronic fatigue syndrome, etc. So that is widely accepted in Singapore. So many people, Singapore is a country which is highly invested in health. So that's why I believe that Ayurveda is a big market over here. And because people are widely invested in health, they are very open to alternative sciences. They do not have any problem in trusting or going ahead with the alternative sciences. So that's why I believe that Ayurveda is a very good market over here. And hence, like one of the Charak's Acharya's aphorisms, that uh, Aturasya Vikar Swasthasya Swasthya Rakshanam and Aturasya Vikar Prashamanam. So Swasthasya Swasthya Rakshanam, that aspect has already gained a lot of recognition in Singapore, and there is much more scope for the same. Moving on, there is another aspect of Ayurveda, that is traditional medicines, herbs, as well as import export of the herbs from India. So, under the SECA trade act that has been signed between Singapore and India, the bilateral relationship between India and Singapore are really good. Whether we talk about economic relations, political relations, or just.
Excuse me, Dr. Maitri.
Yeah.
Your presentation is on the screen. Please guide me for changing slide.
Okay, sir. So you can move on to the next slide, please. Yep. After this one, the second one, please. Yes. So when we talk about Ayurveda in Singapore, the herbs and medicines, the import of medicines, traditional medicines, it has not yet been licensed and legalized over here. So we can get the herbs, raw herbs, which are actively accepted by all the countries, and they do not fall under the poisonous drugs and materials. And these raw herbs in the pulverized form or the tablet form, they can be easily imported in Singapore. But as far as traditional medicines are concerned, the import has not yet been started. Another thing is, like whatever Ayurveda products are available in Singapore, right now they are under the umbrella of nutraceutical industry rather than the Ayurvedic herbs. So if I compare it to other sciences like homeopathy, homeopathy has the official legal recognition in Singapore. Uh, the TCM, traditional Chinese medicine, acupuncture, uh, then Reiki, hypnotherapy, all these sciences, naturopathy, they have the legal recognition in Singapore. And Ayurveda and Siddha and Unani are still to gain the same recognition over here. So over here, as I said, like approach to India versus approach in Singapore, it is widely known as a science of yoga. Yoga is highly popular in Singapore, and I think Dr. Kuldeep will elaborate more on that because that is his stream. And when people come into yoga, they are automatically attracted more and more towards the healthy lifestyle, and that is what attracts them to Ayurveda also. So over here, I cannot prescribe a medicine. But I can definitely say that these are the herbs beneficial for you and that you can take. So there is, and then I cannot claim whether I can cure a disease or cure a disorder or not, but I can generally work with people in overall improving the quality of their life. So that is the major difference that I found after practicing in India and when I moved to Singapore. But gradually I have adopted to the style over here and I'm moving ahead with it. Can we move on to the next slide, please, sir? Yep. So I think, as I said, the bachelor's degree, a BAMS, is not recognized, and that is something that's a major issue not only in Singapore but overall in the world, because universities in the world, they do not have the equivalent degree. In fact, they do not have any university education that is specializing in Ayurveda, not even a diploma course. In US and some other countries under American practitioners of Ayurveda and APAS and all, they are taking it forward. But Canada, Australia, Singapore, the thing is they do not have a recognized university education dedicated to Ayurveda. Hence, people don't even know that such a degree exists or such a science exists. And that's why the bachelor's degree or any education in Ayurveda is not recognized over here. We can show our certificates and they say that, okay, we know you are university educated, but we cannot provide you with a doctor's license. So that is one of the problems faced in Singapore on the present date. And I am hoping that over the period of time, with more active efforts from seniors in India as well as bilateral relationship with all the countries, this is something that can be addressed, and more universities come up with a formal education system that is revolving around Ayurveda. There are many Panchakarma therapists over here. So, despite this being the state, I would say there are more than, Singapore is a small country. So, it is around 750 to 800 square kilometers. But in this small area also, there are more than 50 to 60 Ayurvedic practitioners who own a Ayurveda center. But they don't call it a clinic. It's just a Ayurveda center where they offer different kind of external therapies. And Kerala, basically, mainly based on the Kerala Ayurvedic principles, like Udvartana, Abhyangam, Nasya, Shirodhara, and all these therapies are widely offered over here. And people, if I talk about the general public, they actually do love them and they have found the benefit in it. So, Panchkarma therapists also are recognized in Singapore, and because they have the certification in massage, it is easy to find a job for a Panchkarma therapist than a Ayurveda doctor in Singapore. I am talking from the job point of view. From the practitioner point of view, wide arena of it's a open market. So there is a lot a person can do in Singapore if you want to do and practice Ayurveda and just go ahead with it. Can we move on to the next slide, please, sir? Yep. So, as I said, like one of the initiatives that we can take would be signing, like more and more efforts being put in with different universities to offer the bridging courses so that people know Ayurveda, that even Ayurvedic doctors from India who are planning to move outside India can do that. Like diet and nutrition, psychology, physiology, kinesiology, all these sciences, they are widely accepted over here. So after a Ayurvedic degree in India, if they are to have such a accompanying degree, master's or a diploma in these fields, it would be easy for them to get a job in Singapore or other Asian countries, like any other country in Southeast Asia. Another aspect would be that we have such bridging courses outside India for the BAMS doctors. So doctors, more and more Ayurvedic doctors, like it is very easy for an IT engineer to move from India to anywhere just to do like a master's or let's say MBA or anything. But if I want to do a course outside India, then my platter becomes very limited because there is no MD or MS in Ayurveda offered anywhere in the world. But there can be bridging courses in which BAMS degree can be recognized, and we can easily go ahead with these courses and become a certified licensed practitioner. So that is one thing that requires effort of the whole Ayurvedic community, and as well as on the global level as well as in India. Can we move on, sir, please? Thank you. So one of the things that I didn't value myself as much in India as I do now in Singapore. Not only the science of Ayurveda, but everything associated with it. The in-depth knowledge that Ayurveda provides us about Padarth Vignan or the holistic body, the Panch Shariram or Sanskrit. All these are the USPs of Ayurveda that I have come to respect more and more after coming to Singapore, and especially in the times of COVID. Because after the pandemic started, more and more people are looking to be healthy and gain more immunity so that they are not susceptible to not just COVID, but most of the viral or the bacterial infections out there. So that's where like I gain more and more respect for Ayurveda, that we already have tools and practices in place by Ayurveda that help us to put all these practices in our life on daily basis and go ahead with that. So I've been doing many workshops on the same. I have been educating more and more people who are interested in gaining health through natural medicine and through natural resources in Singapore. So, this kind of education, people over here are eager to learn new things. People over here are very open to accept new sciences, to accept new practices, to accept the new businesses. So, as a practitioner or as a Ayurveda doctor, I would say that that openness gives you more and more encouragement to work over here. As far as legalities goes, I think that can be easily sorted out, and that is something that you can work with. It is not a roadblock to the future. Uh, Another aspect I realized was the holistic approach of Ayurveda and how much it has helped me rather than just looking at a person. Like there is many patients with Hashimoto thyroiditis or the autoimmune disorders, they come to me. So for them, they do not understand the correlationship between all the problems that are present in the body. And when through Ayurveda, I am able to explain that to them in a very simple and natural way, it makes me feel very good. And I think Ayurveda has these tools that you see a person as an individual and not organ systems, or we do not break them into pieces. So that approach has helped me practice Ayurveda in Singapore a lot. I have already talked about the Ayurvedic pharmacology. Can we move on to the next slide, please, sir? Yep. So these are some unexplored territories that I would say, or these are some territories that we can tap in, and we already are since the pandemic started, or even before that. This platform actually proves the same, that we have been becoming more and more technologically advanced and moving into this field. So creative writing, publications, like our presence in nutraceutical and pharmaceutical industry is improving day by day. Even Panchakarma, I would say, is becoming more and more accepted throughout the world. Only thing that would gain more benefit would be if we are able to increase the import of traditional medicines by 200% to 300%, because then the practice as a doctor can be improved a lot, because our hands are sometimes bound when we cannot get all the Ayurvedic medicines formulations from India in Singapore. So if the pharmaceutical industry improves over here, that would be a huge benefit for the practitioners over here. Many of the Kotakal medicines, Planet Ayurveda medicines, and many other companies who are under the umbrella of nutraceuticals are already present in Singapore. But there is a wide scope still for the traditional medicines to be accepted over here. Can we move on to the next point, please, sir? And I think that would be it. That overall, my practice and my journey with Ayurveda in Singapore has been really good. The people have been welcoming. The Ayurvedic community over here has been supportive. And I think there is a great scope as long as the global practice of Ayurveda goes in Singapore. So I'm hoping that more and more efforts are made in that direction so that we can legalize it, license it, and make a formal acceptance of Ayurveda in Singapore. So with that, I would like to end my presentation. Thank you everyone for your patience.
Very nice, madam. Nicely explained the words I view for Singapore. Ayush
Thank you, sir.
practice. Really, I welcome you again
Thank you,
and
sir.
communicate my sincere thanks to you. In this young age, you are really able to communicate well. Excellent.
Thank
Excellent.
you so much, sir. Thank you.
Now I would like to request our second speaker of the day, Dr. Kuldeep Kr Kushwah, who has joined recently, yoga trainer, consultant, and VYASA Yoga. He is from Singapore and would like to communicate his experience to us. Welcome, Dr. Kuldeep. Welcome.
Thank you, sir. Good evening to all. Respected Dr. Pawan sir, Dr. Maitri, and Dr. Risha, and all the audience, all the participants, organizers. I bring greetings from Singapore to all of you. And I'm Dr. Kuldeep here, working in Singapore for 4.5 years almost. And first of all, let me ask, am I audible enough?
Yes, clear.
Thank you, sir. So Dr. Maitri and we have worked together in Singapore in the field of yoga. I have asked her to take her help for some yoga courses, and she has been very nice, very kind, and very great help for all the yoga students. She has really helped us a lot in educating our students from the medical point of view. It's very important in our yoga that people grow in hand in spiritual science and medical science together. So thank you for the opportunity, and thank you for connecting Dr. Maitri.
Thank you.
So
Thank you, Dr. Kuldeep.
I was given the topic scope of yoga and practice in Singapore. Am I right? Yes. So I don't know where to start this, but what I feel is, if I'm not wrong, the audience here is expecting what can we do to reach at the different level in our career point of view, and what are their opportunity and scopes to grow in the respective fields. So
Excuse me, Dr. Kuldeep. Here in audience, all are senior doctor and want to listen from you that what is the stage there in Singapore.
okay, so
All are seniors. On the dais, all are seniors.
Sorry, I'm really sorry. I had the
Welcome,
wrong
welcome,
information
welcome.
then. That's why it's really good to know
We have passed our age and now on retirement words.
Okay, fantastic. Then what should I speak
All
on
are
this?
in 60s.
So I think I'm the youngest one here. I'm 34 only. Approaching
I think,
to
Doctor, they would be amazed to know the journey that you have covered since 14. You have been
Yes,
14 years
yes,
old.
yes.
So, and that since I have worked with you, I know how great it has been and how you have, made yoga into something so simple and something so easily acceptable through to the whole community. Because I have worked with you, I know that. So I think that would be something that everyone would be like very much grateful to know
We
that.
will be welcoming. We will be welcoming those thoughts.
Yeah.
Okay,
Thank you.
thank you. So I had a different concept, different way of understanding of this webinar, but thank you for correcting me. So let me start like I come from a very small town in India. I think we have spoken just before yesterday. Dr. Pankaj, it's near Gwalior, and where there's very small town. From there to Bangalore in my PhD education, and from there to Singapore, it has been very learning and very uh, great experience. So what I found is from my career point of view, like when I started my master's and doctorate, I had no clue that where yoga can take me. And my all the students used to laugh on me. They used to say like, you'll become Baba, you'll go to forest and all this like, and I also really didn't have any understanding that time. I used to feel sometime like inferior, like all my students are doing chartered accountant, MBBS and management degrees, and where I'm going towards yoga. But who knows like when and where the yoga and what is coming on your way. But today they all see me in this field, and I'm here today and also teaching yoga around many Asian countries. So they say like I had selected the right field, and I am really thankful for this yoga field. Because of yoga only today I'm here, where we do not only get what we need for our living, but also we get a lot of respect. And more than that, what I found is when you can help somebody with what your skills and what you have learned in your life, that is really meaningful. Yesterday one of my students was asking that, sir, don't you get bored of teaching? Because I teach all 7 days. In past 4.5 years of my Singapore teaching, I have not taken even single day break. It's only when I go outside in during holidays, I just teach there. So they say, don't you get bored? I say, of course, people can get bored. I can also get bored. But when I see my student really recover from their pain, their disease, disorders, and they smile and they recommend my teaching to many of the students, and that really recharge me. And can you believe like sometimes I can take 10 classes also from morning to evening. So I think this is uh, the God who is always behind us, the force which is behind us. We cannot really expect ourselves to work at this level, and wherever there is a good work going, wherever there is a service from our side, the God is always there to help us. And in 4.5 years, I did not really expect. If you listen my journey, how I came here and how it started, you will be like surprised. Like, so I always say, my friend, like, you please go and start wherever you are able to start. Sometimes it happens like people, let's my friend are there in India, some Nepal who studied with me, and they are still expecting like they should get a big opportunity to start from. And I started from nowhere, and today I have I'm proud to say that today I have hundreds of students in Singapore, and they are really getting benefit from our teachings. So it's been very good experience in 4.5 years working in Singapore, because Singapore is a country which is connected to the world. It's a hub actually. So from here, I'm reaching to almost all the world. Today, I have around 60 countries students. So I'm sitting here, but teaching in many countries. Now we have online, offline teaching together. Before COVID, we only had in-person classes. But today, the COVID has taught us a new lesson. Like now you can connect to the world. So first month was very difficult, but second month onwards, it has been very good. Like now my students from many countries can connect to me. Once it, otherwise it happened before, like, once a student left the country, you cannot have connection with him or her. But now, due to this COVID, it has given us a new learning. You can combine. So we are sitting in a small room, but can have 100 participants. The room capacity used to be 10 to 12 people, but today it has reached to many. So it's really great to be in contact with all the students, and they are able to learn from their best teacher or their teacher whom they respect and they believe in. So I think, yeah. So when I came Singapore, I didn't know anybody, but today, uh, sometime sometime it happens, like even I'm in some mall or some shopping place, so I'm scared. So students can find me and can see me there. So it's good connection. Like, yoga is connecting. Yoga is union, right? So it's connecting us from with each other. Whether you have we have a lot of doctors who are from Ayurveda field, and we got to know each other, and we are working with each other. They are sharing their skills with us, and we are sharing our skills with them. And slowly, we are trying to build a good team and working together. And the thing I would like to share with you is good that we have a good everybody saying something. Okay, so it's good that we have got some very good learning from India. So I would say, like, I was fortunate to learn from different universities. So my PhD was from SUS University, my master from different university, my PG diploma from different place, my the basic certification course from different place, and it's God's grace that I got yoga learning in my school time from 13 year of my age. So it's been now 20-year plus already. And so learning from different background and reaching at the right place where I can use my skills. So today I play the role of like all rounder. Somebody come from yoga therapy, looking for yoga therapy, I can help him in yoga therapy. Someone come for learning advanced postures, I can teach advanced posture. So I think at this place, if you have more skills, you can grow endless. You can help millions of people being seated in one place. And there is endless scope of yoga, not only in Singapore, but around all the countries. I have traveled in many countries there, and I found that yoga is really growing very well. When I was in Vietnam for 1 year plus, I found that every street I've got yoga studio, and many of my friends from India, they have gone there and they started teaching with some studios, and now they have their own studios there, and they have hundreds and thousands of followers and students participating, practicing with them. Same here in Singapore. Many of my friends who came here, they work with some companies, and today many of them have their own studios, not only one, but five branches. So I think the market is there, scope is there. What people need is actually uh, beginning from somewhere, having right type of education in yoga, and using their skills, their experience, and slowly accept it. I mean, trying to adapt in the new environment. For example, when I came Singapore and I went Vietnam, two different things. In Vietnam, I struggle a lot with the language because the people don't speak English there, and I was really struggling. I don't know what to do. Then I have to learn Vietnamese. I started taking class in Vietnamese language. So it was really great that I could connect with the people, and because I'm vegetarian, because I'm from India, because they follow a lot of Bollywood movies, and they love Buddha. So a lot of things, and they see in me, and they only see people who have done very short-term courses, 200 hour, 300 hour, and I'm coming from master and PhD background. So I got huge respect. I didn't even expect that much. Can you believe I went Vietnam for 14 days, 17 days for conducting one workshop, and that turned to 1.5 year in Vietnam and 2.5 year in Singapore. Then I went back India. And after that also I traveled around many countries. So it's only because when people see you, like you are bringing something value lesson for them, some value teachings for them, they really respect a lot. Everyone would accept you, everyone would respect you if you are bringing some good health and blessings and from our country, from our culture, from our system. And it was amazing journey in Vietnam. Only and then they were not willing me to let go from Vietnam. They helped me to establish my company in Vietnam, but because of a lot of language barrier, I need to move from Vietnam to Singapore. And when I moved to Singapore, there was total new market here, new people, everything was new, and nothing was there. Like I should start from the company I joined, they had their own system working and the system was established for them. I need to start from zero. So for 1 year, you won't believe, like day and night, I was like thinking what to do, what to do. So whatever program I can design, I tried my best. So it was like good learning part also. I designed my courses, I design my flyers, I market myself, and I conduct my program. From that stretch, can you believe, like today, I have like once I launch the program, my classes are full already. They book in advance. So that time was 1 year before when I was like in a very beginning stage. And today, not only Singapore, but also we have reached to many countries. And we have the online and offline classes, right? So today evening also I have many countries joining from Turkey, Mexico, Japan, India, Sri Lanka. So it's really blessing that you can do a lot from one place itself. So last year I was about to go Croatia, Alaska, and Holland in March, month of March, and I could not go because of this COVID. And before, we must have time to go there. We spend our time, we spend our money, everything there. But today, no need to go anywhere. You can teach from here. So now my student conducting workshop in America also, I conduct workshop. In Europe, I conduct workshop. I don't need to go anywhere. From one place, I'm reaching everywhere. And from one place, I'm able to help many more people. Before I used to help one person or 10 people maximum. Today I can help 100 of people. And thanks to this technology, thanks to this platform, and thanks to all the friends and my teachers and our employers who help us to grow at this level. Yeah, so Singapore is working very well, and we are hoping to have all your support and blessings to do more significant work for the community and society in coming time.
Excellent, excellent, doctor. Excellent.
Thank you, sir.
Very nice.
And
Nicely
I can
explained your.
vouch for his dedication. Like I have seen him, what he has talked about his struggle till until here. He has this very inclusive quality about him that he never discourages even a single student. He just takes them forward and glides them easily from one stage to another. So that inclusive quality about him is really great, and I have seen it since the beginning. Also, like he's being humble, but he has been closely associated with the High Commission of India and conducting International Day of Yoga here in Singapore. And he also does various workshops of yoga related to insomnia, depression, anxiety, diabetes, and all the like therapeutic role of yoga in living with these disorders. And Dr.
Great,
Kuldeep, if you can
great.
just let us know a little bit more
Yeah,
about that.
so
Yeah.
thank you.
Without great achievement
But then
within this age.
uh, when you do work from your heart, when you really do not see yourself as motive every time, yeah, God can take you to any heights. And can you believe last year it happened that I didn't know, somebody informed me, sir, you have been selected one among the top 10 teachers, yoga teachers in Singapore. I say, what? I didn't know this. They informed my company, they informed everyone, but nobody told me. I don't know how they selected my name, how it reached to them. But when I came to know, then all my students say, sir, you deserve it. I say, I don't know, but thank you for this reward. And apart from that, like, yeah, the Diabetes Singapore Society, they have been inviting us for conducting yoga therapy for diabetes patients in Singapore General Hospital. So, and I worked with the cancer care HCA here, and Cancer Vibe Singapore for cancer patients. We have worked a lot. We have worked for Rainbow Foundation. I have volunteer. All these places have volunteer. I don't go as a professional there. And the Rainbow Foundation for anxiety, depression patients and public. And also Indian HICOM, they always call us for during the International Day of Yoga or any yoga event is there. We always go there. Even our Prime Minister Modi ji came here. I was one of the team member who designed and who choreographed the yoga dance. So I've been very fortunate. I would say, like, they always approach to us. They see our skills. They say, like, they believe, they trust in us, and we try our best to help them from our best. And apart from that, I have started some of the courses here which were not there before. I found the need. I study market in 1 year, and I came to know that there is a need a lot for the student who have done a basic level teachers training course. There is a need to upgrade their skills, and I have started one course here that is called 100 Hours Advanced Hatha Yoga Instructor Certificate course, and that has been very well received by many students. And Dr. Maitri has helped me to take the anatomy part in that initially, and that course has been really rich. And in my batch, let's say the 10 students, they will be from 8 different countries. That is the strength of that course. The course imagined by me, designed by me, and all the notes, everything created, developed. I remember, I know that 3 to 4 months it took for me to completely be work with one course. But now the product has come. Even I'm ready to give to any university who want to take the course. This entire syllabus, everything can take, no problem. And so like that, I have started many such small programs that have become a very brand today, and they have been well received by many people. Today, when I launch any program, the classes are all full. And before, very small number, but now many more number because it is also online. So yeah, with the help of like all my friends and teachers, trying to develop more, and all the many programs like mass events also we conduct here in gardens, in open, in like marina barrage, rooftop, where hundreds of participants, people can come. And one day I was surprised when I just came Singapore. I was surprised when Indian High Commissioner, Mr. Javed, he was talking in some program, and he was quoting my name. Today I met Dr. Kuldeep, who has done PhD in yoga and who has published 7 papers, and his research has been awarded international conference. Like, he was quoting my name, and I was one of the audience. Can you believe? So it felt like very great that if Indian High Commissioner talking in a big event and quoting me, it feels like good. Uh, so yeah, with all your blessing and support, I'm just trying my best to do whatever I can.
Thank you, Doctor. Thank you, Dr. Kuldeep. Thank you very much. Very nicely explained your whole journey, and it's appreciable also. No doubt, it's appreciable.
Thank you.
Your dedication, sincerity, with that, you have achieved new heights, and we bless you. We all senior bless you to achieve new heights and horizon.
Thank you so
All
much,
the
sir.
best. Now, I would like to request Dr. Risha Sharma, Ayurvedic physician and naturopath, Sundar Das Naturopathic Clinic. She is BAMS and diploma in naturopathy. So I would like to welcome Dr. Risha Sharma.
Thank you, sir. First of all, greetings to all my seniors here. Thank you to Dr. Maitri and Dr. Kuldeep also, and for sharing some valuable information on the logistics and the legal issues that we face in Singapore. And it's interesting, Dr. Maitri and me go back a long way. We almost simultaneously moved to Singapore together in 2016, and fate has it that we met immediately, I think within a month or two of moving to Singapore, and ever since it's been great friendship and very mutually beneficial alliance as Ayurvedic doctors, which is a challenge in Singapore. Am I audible? Okay, so
Clearly.
I am from Ghaziabad, Uttar Pradesh, born and brought up there, and then I completed my BAMS from Maitri Nagar, Swami Kalyan Dev Government Ayurvedic College, and after that I moved to Chandigarh in 2014, and from there I did my naturopathy and yoga therapy diploma. And then I got the chance to work with Planet Ayurveda, which is one of the emerging nutraceutical company in India and worldwide. So I had a lot of experience with the digital marketing and how I think it is the need of the hour for Ayurveda, and a lot of work has been done in the last 6-7 years, as I've been seeing. But marketing is what we have been lacking in these years, and this is something that I learned in Planet Ayurveda. I worked with them for about a year and a half, and it's really commendable that the way they have brought Ayurvedic herbs and treatments to an international standard and acceptable worldwide. And after that, I moved to Singapore, of course. And luckily, because of as you know, there are challenges to get a job in Singapore as a BAMS doctor. You can work as a therapist and you can work as a business person. Being a doctor is not recognized as a clinical practice in Singapore for Ayurvedic doctors, especially. But you can work as a business person. So all the therapists and Panchakarma centers that operate there work. I mean, Dr. Maitri has really elaborated very well on the challenges of the practice that we face there. So I was lucky enough to get a job with a naturopathic clinic there, which is Sundar Naturopathic Clinic. It's a very old clinic, and I have been working with them since then, since the year 2016. And it's been 6 years. I'm currently in India for this year since February. But I'm still working with them. I'm taking patient consultations and nutritional consults. So, so today for the presentation, I am basically sharing what my journey has been in Singapore in terms of as a practitioner in Ayurveda, and I have now moved on to a more integrated approach of treating patients. My experience has been intensively with functional medicine, plus Ayurveda and homeopathy. So it's interesting that as I'm gaining more experience in this field, functional medicine is an emerging science, and it's only recently that people are doing naturopathic bachelor's and master's, especially in Canada and US. It's an emerging science for maintaining and for the maintenance of health, and all the concepts are rooted in Ayurveda. They talk about gut-brain axis. We have all the problems that we treat through the gut. They talk about psychological issues. We have talked about manorog in Ayurveda for years and years. So I always believe that people think that Ayurveda is obsolete or not so apt in today's world, but on the contrary, it's, I think, far ahead for today's time, and people are still catching up. Modern medicine is catching up with Ayurvedic principles, and I think it will take even more years to be able to get that acceptance, because it's not because there's something lacking in Ayurveda or Ayurvedic practices, but because people have to get to that level to understand what Ayurveda is and where it is rooting from and how it is applicable to our holistic health and body. And being in Singapore, obviously there were challenges explaining to people about what Ayurveda is and how Ayurvedic doctors operate. But given that 80% of people in the Singaporean country are Chinese origin, and they are very, very, they're very, very connected to their traditional system of medicine, which is Chinese medicine, acupuncture, chiropractic. So it was easier to explain. And there are a lot of people are open to herbal treatments and Panchakarma and all of that. We don't do that in the clinic though, but I have seen that people, I mean, my main practice involved treating through supplements and nutraceuticals. So what all herbals are available in Singapore as nutraceuticals, we were able to use them. And apart from that, homeopathy I have gained a lot of experience in that. And so today's slides that I have prepared for my presentation are based on the 6 years of my experience in different health modalities and the kind of patient complaints that we get as natural healthcare practitioners, the kind of cases we get, what is in demand nowadays, why people come to an Ayurvedic practitioner or a functional medicine practitioner. So I'll be shedding some insight on the different health categories of patients that we get in the clinic and my experiences with them so far. So moving on to the first slide, which is female health. Sir, you can move on to the female health slide. I think it's number 3. So more than 50% of patients, interestingly, that we see for naturopathic health care management are females. And it's interesting because what I have some experience with human psychology also, and I'm trying to pursue some degree course in that in the near future. But with what all clinical experience I have gained in human psychology, females are more connected to their bodies as compared to males, thanks to the estrogen hormone. And so if whatever disorders that are being developed in our body, we are more in touch as compared to males. I'm not saying they are unaware or really out of sync with their bodies, but if you compare the statistics, females are in general more open to holistic treatments and maintenance of health. Males wait until something goes wrong and it's a question of life and death. Only then they approach for radical changes in health and dietary routines. So that's what my experience has been. More than 50% of our patients have been female, and they come for all kinds of complaints for general health maintenance, very common problem, hormonal issues, polycystic ovarian syndrome, fibroids, endometriosis, infertility issues, thyroid, and perimenopausal issues. So we get women from all age groups, and we see them from all kinds of hormonal problems, breast cancer, gut issues, chronic fatigue syndrome, another very common lifestyle problem, which can actually turn into an autoimmune problem very quickly. So this is very, very commonly seen in my practice, and most of our patients complain of fatigue, malaise, and they don't know what's happening with their self. And actually what we can offer them is expert dietary advice and nutritional management that helps them. And interestingly, there is not much of medication in modern medicine that can actually help them with fatigues and malaise and general something is wrong, but I don't know what is wrong complaint. So this is what I see very commonly in everyday practice for female health management. And in general, it's amazing the kind of result we get through our treatments, be it Ayurveda, homeopathy, naturopathy, or some of the functional medicine concepts that we integrate into our practice. And can we move on to the next slide, please, sir? Okay, gut health. I think people who know, for a lay person also, everybody knows that when we talk about Ayurveda, we talk about gut health first. So पेट की problem है, तो obviously Ayurvedic doctor can help. So this general notion is worldwide. Like if you have gut issues, you can actually approach a natural health practitioner, and people in general are increasingly more aware that you cannot solve acidity, reflux, constipation, watery bowels, small intestine bowel overgrowth, and dietary issues through modern medicine treatments. So when they are open, it's easier to explain it to them, and then the results are astonishing when we make some dietary changes and herbal and nutritional support. The results are really good, and I mean, you can actually cure acidity acute acidity in as long as minimum as 2 to 3 days with the right changes in the diet. So the results are really, really effective. Leaky gut, again, as I mentioned earlier, this is like a modern concept of our Vata with Kapha imbalance in the gut, and it is rooted in all the autoimmune problems and brain and gut-brain issues and psychological issues like mental issues like Alzheimer's, dementia. Alzheimer's nowadays we call it as secondary diabetes or diabetes of the brain. So all this is rooted in the gut, and we see it very commonly. And Ayurvedic and some biochemical management actually really helps with these two problems. Ulcerative colitis, this another autoimmune problem, IBS, psychosomatic disorder. IBS is a very common complaint, and most people are underdiagnosed about IBS and they don't know they have IBS, and the kind of connection they have with their emotions to the gut. So it becomes very interesting to counsel patients with these kind of complaints, and it's very satisfying when you see a patient becoming self-aware after having an hour consultation, and they start looking at their body very differently. They start looking at their diet differently. They start looking at their approach towards life differently in the long run. So I think this is what the strength of Ayush is, and this Ayush medicine systems is, and this is this is what our forte is as Ayurvedic doctors and Ayush practitioners. So stress-induced gut issues and lifestyle-induced gut issues are other very common problems that we see nowadays. And so autoimmune conditions, if I talk about, again, people come to us with either acute diagnosis or with having tried and tested all kinds of treatments and already going into secondary autoimmune problems, and they don't know what to do. They are on all their autoimmune immune suppressants and biogenics treatment, but obviously the general health keeps deteriorating. And we see changing diet and nutritional support in these kind of patients actually has helped them go into even remission for acute cases. So our focus in acute cases always is to help them switch off their genetic predispositions and prevent the triggers from activating the problem even more. And also for chronic cases, we focus on preventing development of secondary autoimmune issues. This is the list of all the cases that I very commonly see in my practice: Hashimoto's thyroiditis, rheumatoid arthritis, ulcerative colitis, some cases of SLE, fibromyalgia, psoriasis, and leukoderma. I'd like to mention a case about leukoderma where this guy, a 40-year-old Indian guy, he was a bald guy, so we could see the white patch on his head very clearly. It was about a 2-centimeter big patch, and we did the work with him, and in an year's time, he went into remission. There were dark skin-colored spots growing on that white part, and that was like proof of concept for me that just dietary and nutritional support and the right kind of herbal detox actually helped him treat autoimmune problems, for which like leukoderma is famous for being an untreatable disease or something that modern medicine has no cure for. So these are the kind of results we get, and it's very satisfying. And for pediatric care, if I talk about another very common group of patients that we see, and for flu, diarrhea, constipation are very easily managed through natural therapies. And I think another very interesting thing that I like in Singapore is that antibiotics are not very commonly available there, unlike Singapore, unlike India. So people are looking for natural treatments to treat their infections, allergies, and acute problems that are normally treated through antibiotics in India because of the wide availability of these drugs from door-to-door chemists. So I have seen people get better for these conditions without antibiotics, without any IV support, even in mild to moderate cases. So this is also under the scope of Ayush and functional medicine that I have seen. And I have had the chance to work with a lot of autistic kids in the last 6 years. And before joining this clinic, I didn't have much knowledge about what autism is and how, how should we approach treating autism. as if you talk about Ayurveda, I'm still unsure about how to treat autism through Ayurvedic management. I can do some things because the challenge with kids is that a lot of procedures are very difficult to perform on young kids as young as 2 years old. You can't feed them all kinds of medicines, and especially with autistic kids, they are very, very picky eaters. So it's difficult even to change their diet. So talk about herbal supplements, Panchakarma like treatment, Shirodhara and all that is actually scary for them. So so we take a very integrated approach in treating the autistic spectrum disorders, and we have seen kids who were practically non-verbal, very hyper, who could not focus for more than 1 minute, go to normal schools and perform equally well as normal children. So that is the scope of functional medicine and naturopathic practices. I think autism is an emerging problem thanks to vaccinations, environmental toxins, and there's a whole case study about how a lot of environmental triggers can induce autism in children. Boys are more susceptible than girls, and even in India, increasingly we are seeing more and more cases of autistic problems, and there's no treatment in modern medicine for autism till date. And I have seen children get better, and obviously it depends on the earlier you get the patient, the faster the results are. But there's a lot that can be done through natural therapies in terms of autistic spectrum disorders. In eczema also, we manage very, very effectively in young children and even prevent them from going into frequent relapses. And coming to metabolic syndrome, a very common problem worldwide, I think. In India, I think it's a bigger problem as compared to Singapore. The obesity issue is and the diabetes is much more prevalent in India as compared to Singapore. But cholesterol, I have seen a lot of cholesterol patients in Singapore as compared to diabetes and heart disease in the last 6 years. And it's a very straightforward management through dietary modifications and herbal support. And it's the need of the hour, I think, that even modern medicine doctors woke up to the dietary, the importance of food in our treatment protocols. I can see that the universities have started offering nutritional programs to medical doctors because they are not trained in nutritional sciences as such in their MBBS and MD unless and until they are specifically doing it in a particular field. So I think that's where our strength is, because in Ayurveda, we learn about diet right from day one. We learn about lifestyle management right from day one. So that is what the strength of Ayush is in terms of managing lifestyle problems and metabolic problems that we are seeing increasingly nowadays. Next slide, sir, please. So coming to the last slide, I have had a limited experience with cancer treatments, and the most common cases I've seen is breast cancer. And what's interesting is that we have equipments now that can actually diagnose breast cancer and even cancer for 10 to 20 years in advance without any invasive mammography or PET or biopsies. So I've had the chance to work with patients for breast cancer in this right from stage 0 to terminally ill cases. And of course, the prognosis varies from patient to patient, but the results are really good. And especially for patients who are on chemotherapy and radiotherapy, I think Ayush system of medicine helps them give supportive herbal and nutritional support to improve their general condition, because most of them are suffering from side effects of chemo and radiotherapy, and there's nothing that can be done through modern medicine in these situations. So we offer a lot of secondary support to cancer patients, or a lot of nutritional support to them. Next slide, please, sir. Finally, I think mental health is something that is the need of the hour. It's the most underdiagnosed problem nowadays. As I'm gaining more experience, I can't see any health issue, be it a simple acute cough or a sinus, to a very serious chronic illness that is not related to mental issues. And people are becoming more and more aware of how mental health is just not about having a mental illness. it is much more than being mentally ill or being labeled as having an issue that needs medical treatment. So it is linked to a lot of hormonal issues, heart problem, diabetes, cancer, etc. And so a lot of counseling and brain training exercises help people cope better with their behavioral patterns. And we actually integrate a lot of this kind of training with our patients, apart from side by side with the dietary and herbal and nutritional management that we do for them. And it's quite surprising that there are people wherein they're doing everything right, they're eating right, they're taking the right medicines, and still they are not getting better. That's when mental health issues come into picture. And that's where I think Ayush system also helps, because in Ayurveda we read about Manorog and how Chintan is the root cause of a lot of our gut problems, and how leading a certain lifestyle, Dincharya, Ritucharya, the significance of all of these things. We talk to people about it, and once they try it and understand how diurnal cycles work, how our wake up morning to evening, how our hormones change, and how our body responds to exercise at a particular time of the day, and what are the adverse effects of leading a lifestyle that is different from the sync of diurnal cycles. They become more and more aware of their health issues, and it actually helps us as practitioners to treat them better. So addressing mental health has become as important as addressing any other ailment in the body, and without which any treatment protocol, I think, is incomplete. And as I am venturing into my private practice slowly, I realize that this is something I keep a separate consult for mental health issues for patients, mostly the second or third time, because I know without that it's very, very difficult to make people understand and the importance of holistic sciences and how our body works as a system, as a unit. So I think we should focus more and more on these kind of issues also. And to conclude, I would like to say the scope of Ayush therapies is growing with passing time. And in Singapore especially, I have seen people become more and more open to natural therapies. And we all know people come to Ayurveda and homeopathy after they have, many people come to Ayurveda and homeopathy after they have seen their medical practitioners, and they are tired of taking medicines and they don't know how to solve their problem anymore. So the same cases there in Singapore as well. But if I think the logistic issues improve and we are able to get more herbals and supplements in Singapore, and there's more recognition for Ayurvedic practitioners as doctors in Singapore, we will have better prospects, and the treatments, and we think there's no doubt about treating people with Ayurvedic therapies and Ayush systems. But the only challenge remains obviously is the logistics part and the legal issues that we face. But obviously it's not a roadblock, as Dr. Maitri said, and there are things that we can do as practitioners. Dr. Maitri is like a live example in front of you, and I think that this is what we should also inspire to achieve as practitioners in Singapore, as individually practicing practitioners in Singapore. And I think this is what is the strength of Ayush is also, and its practitioners as well. So I think this ends my seminar today. Thank you all for being patient with me, and I hope I could add some value to the already big knowledge pool that you all share with us. Thank you so much. Thank you, Dr. Pawan. Thank you, Dr. Maitri.
Thank you, Dr. Risha. Excellently, you have described all the complete practice, what you are getting there. Really nice, very nice. I am thankful to you all, especially
you,
Dr. Maitri also for introducing you, such dignitary, no doubt. In this young age, your communication power is very good, very good. All of three,
Thank you
no
so much.
doubt. All the best to all three speakers. Now I would like to invite experts of the dais. Initially, I would like to invite our guardian, Professor Vishnu Prasad Sharma ji, then Rajan Patankar ji, then Khatavkar ji, and then for concluding remarks, as Dr. Agnihotri was in both the webinars, for concluding remarks, today Dr. V.K. Agnihotri ji, I would like to request Dr. Professor Vishnu Prasad Sharma ji, ex-principal, Government Ayurvedic College, Guwahati, from Assam, northeast of India. Welcome, sir. Welcome, sir. For your blessings, few words. Kindly unmute yourself, sir.
Namaskar. Good evening to everybody. Respected Dr. Pawan Kr Sharma ji, eminent speaker, distinguished guests, ladies and gentlemen. First of all, want to offer my sincere thanks to Dr. Pawan Kr Sharma ji for organizing a wonderful webinar, Scope and Practice in Singapore. I have listening all the things from the eminent speaker. All the eminent speaker has presented their speech very nicely. Dr. Maitri has nicely explained how she gave treatment at Singapore. Dr. Kuldeep, yes, he is a very young. All the three eminent speakers are young, but they are more energetic. Dr. Kuldeep, yes, he has given training yoga most of the countries, and he said in different language also. He give training in Vietnam also. He told that in Vietnam language also he give training to the students. Thank you, Dr. Kuldeep, for your excellent work. God bless you. You have to do more hard work. And next, I want to offer my sincere thanks for Risha Sharma, young, energetic Ayurvedic doctors. She showed and what type of treatment she has given there. At Singapore, she showed how to give treatment for gut, mental health, cancer, though she has not so much experience in cancer. But in country like Singapore, she has started giving treatment, Ayurvedic treatment. It is a very, very good thing. So dear Dr. Risha Sharma, if you want any suggestion, you can contact me. Right now I am the professor and consultant in Government Ayurvedic College, Assam.
Okay, sir.
Guwahati. If not only you, Risha Sharma, all the three, this Kuldeep and Maitri, if sometimes, and our Pawan Sharma is there, you can take help from Pawan Sharma is also there. The name is Pawan. He always help everybody. He always helps, just like a Hanuman. And when you are suffering from any problem, if you pray to God, Hanuman, he helps. So regarding any Ayurvedic knowledge or any treatment, anything, you can contact Pawan Kr Sharma ji. Or regarding treatment side, if you want any help, you can contact. My name is Professor Dr. Vishnu Prasad Sharma. I will give you, and you can take my email and phone number from Dr. Pawan Kr Sharma ji. He can send. So I offer my thanks to all the eminent speakers and wish you all the best for future. Hope
Thank you, sir. Thank you so
you will
much.
be a very, very good expert in AYUSH. Namaskar to everybody.
Thank you, sir, for your blessings.
Thank you so much, sir.
Thank you. Now I would like to request Vaidya Rajan Patankar, sir. Am I audible to you?
Yes.
Blessings to all young generation.
Not blessings, because you are our master batsman, taking this initiative to reach us and all the people to all over the world. Because today it's a 216th webinar you are conducting, So hats off to you, first of all. All the three speakers had presented very excellently, but still they are having some hurdles in the other countries than India. They are doing a great job to promote or to reach to the people or to the common people through Ayurveda and through not only Ayurveda but our lifestyle. Lifestyle is also most important, and that includes our routine work, then yoga also, then lifestyle management through dinacharya, rutucharya, and it's an excellent job they are doing there, uh, having so many hurdles. And in my opinion, now they must now because they are settled for last 5 to 6 years. Now public awareness, in my opinion, is must. So they should conduct some free webinars or some free lectures for the common people, because as we know, if we want the Rajashray, it is most important to take through all the peoples or the community to make it possible. So thanks a lot. Very excellent presentations and your thoughts. So all the best to you, because I'm not that much big person like Vishnu Prasad, but still my blessings and all the best to you. Thank you, Sharma ji. Thank you.
Thank you, sir.
Now I would like to request Dr. Rajendra Khatavkar ji, medical legal expert. He is BMS also, he is LLB also. So he is the person from law. Would you like to say something, Dr. Rajendra? I am not audible to him, I hope.
Thank you, sir.
Yes, yes.
You are audible. Am I audible?
Yes,
Hello?
yes.
Hello?
Yes. Yes.
Thank you, Pawan ji. As Professor Vishnu Prasad has told, as your name is Pawan, and you have done a fantastic job bringing all gems from every corner of the world together, and we are having an opportunity to interact with, and we are becoming aware that what is happening in the every corner of the world. As today's three James speakers, with the Maitri Nagar, even Dr. Kuldeep Kushwah, and with Risha Sharma, all the people, we should congratulate these three. These are crusaders of Ayurveda, that in spite of not having recognition, legal recognition in the country like Singapore, and these people are practicing. Ayurved की पताका ये लोग लेके चल रहे. And as they have told that 80 in the Singapore, 80% people are Chinese, and their minds are overwhelmed with or occupied with the Chinese medicine. Similarly, we can try to get the recognition for the Ayurvedic and medicines or Indian systems of medicine. As Dr. Vaidya Maitri has told, that there is a recognition, legal recognition for homeopathy, even acupuncture, even Reiki and naturopathy, then why not Ayurveda? Whatever legal resources or whatever they require, we will provide them. And as that somebody told, that High Commission is also is in their touch. So जब तक बच्चा रोता नहीं तब तक माँ भी दूध नहीं पिलाती है. So we have to try unless till you succeed. So here I remember one poetry of हरिवंश राय बच्चन, कोशिश करने वालों की हार नहीं होती. So कोशिश करनी चाहिए, एंड टिल हमें रीगल रिकॉग्निशन नहीं मिलता है तब तक हम लोग न्यूट्रासिटिकल करके कब तक जिएंगे. ये 5000 वर्ष पुराना हमारा साइंस है, एंड वो उसको वो दैट इज स्टिल कॉल्ड एज अल्टरनेटिव सिस्टम्स ऑफ मेडिसिन. सो हमें ट्राई करना चाहिए टिल वी गेट रिकॉग्निशन. एंड people, and in that country, they get recognition for Panchakarma Therapist. They recognize that Ayurveda therapist, but not as a doctor. So proper follow-up of that health department of that particular nation, ministry has to be done. And whatever help required, legal help, we will do from our side, and whatever theoretical and
Thank you, sir.
administrative help, as Professor Vishnu Prasad Sharma ji has made them available. So all the three doctors, it's an appeal from this dais under the leadership of Pawan Sharma ji. Whatever help we are here to do, और आयुर्वेद की पताका ऐसे ही फड़कती रहे और आप लोग ऐसे सक्सेसफुली प्रैक्टिस करते रहे. बेस्ट लक. जय धन्वंतरी, जय आयुर्वेद. धन्यवाद.
Thank you for your blessing, sir. Before concluding remarks of Dr. Agnihotri, I would like to request Senior Most Dr. Jagdishwar ji to bless speakers and to say few words. Dr. Jagdishwar ji, please.
Pawan Kr ji, namaskar.
Namaskar, sir.
Is it audible? Is it audible?
Yes, sir.
Is it audible? Well, actually, sitting here, a remote place or a district in Telangana, I am just in contact. While the Singapore speaker started, only few visuality was there. Later on, it disappeared, and only I am in contact with audibility. That's all. Okay, it's all right. Singapore is now a popular name gained as an aristocratic life. And people used to prefer in that sense only. And their lifestyle is also aristocratic comparatively near our country. And especially a little place having so much popularity in the world, how it gained, what is the legacy of its gaining that much is not, I think, that go beyond of 7,500 years or 5,000 years. Though our heritage is such, but we could not flourish. How? Why? There are two senses. One, even about yoga also, till now, the people whosoever is practicing in the entire world, I say that yoga is a word derived from Sanskrit, one plus yunj plus ghai, and another is yuj plus ghai. Yunj plus ghai is different from yuj plus ghai. If anybody, well, Sanskrit analysis are there. The presentation till now, even in the entire world, leaving some section school of thought, yuj plus ghai only. That means it is not yunj plus ghai. Last time only I referred that yunj plus ghai means 1 plus 1 becomes 1 only. Yuj plus ghai means it is the combination 1 plus 1 becomes 2. This system of presentation while going on, and we may not go. So, यहाँ पर मैं एक reference, now I give a little reference of whichever you think may be better. So, कबीरदास बोलते हैं कि आसन मारे क्या हुआ जो गई न मन की आस, कोल्हू के बैल फिरे गरही कोस 50. क्या योगा का रेफरेंस यहाँ पर नहीं है? योगा का एक्चुअली रेफरेंस है आसन मारे क्या हुआ करके जब बोले. तो यहाँ पर योगा प्रेजेंटेशन टिल टू दिस डेट व्हाट आई एम सीइंग इन द मीडिया is not actually a represent as a right presentation. It's a part. क्या अष्टांग योग में इतना ही बताया गया? जी, अष्टांग योग में बताया यम नियम आसन प्राणायाम प्रत्याहार ध्यान धारणा समाधि. Why all these being taken? If yoga presentation is only limited to either pranayama or asana, why all these references? That's why it's a lengthy subject for leaving yoga. And
Thank you.
for
Thank you.
personal
Today only
experience-
bless, sir. Bless speakers.
Yes.
We need
yes.
your blessings. You are
Yes,
70
yes.
plus,
I'm
sir.
going to. I'm going to that aspect only. Young people, I have seen on the visual aid that young generation, you have to take it to the heights of that yoga. What I feel, the yoga, the Adi Yoga Purusha is Sadashiva. How he has become Yoga Guru, and how Adi Purusha and Yogeshwara. And Yogeshwara are the two references. One is for Sadashiva, and the next we will see only in Mahabharata, that is Krishna. These two personalities are referred as Yogeshwara. Like that, if you take into the concept of this yoga, now I conclude. But at the same time, I wish you all the best. At least the young generation will on one day come to know, and I hope that you will present the right perspective of the yoga. And whatever it may be, whether the Singapore government recognizes as a title by doctor or actor, whatever it may be, but leave that aside. But only one thing, I will get myself consoled that your struggle is put forth, and a day will come that they themselves voluntarily recognize what Ayurvedic, what tradition of medicine of Bharat. I don't say India. It's a tradition of Bharat. It conquered.
Thank you.
And it will
Very
become.
nice, sir.
And also,
Very nice, sir.
I conclude with this little words. If
Thank
at
you.
all anything became a critic, I ask for just consolation.
Thank you. Thank you.
Thank you very much.
Dr. Manvendra Sharma, Mr. Manvendra Sharma, owner of Ayurvedic Clinic in Kolkata, Wellness Center. Would you like to say something? I hope I am not audible to him. So I would like to request now Professor Dr. B.K. Agnihotri ji from Haridwar, because he was in both the seminars, both the webinars. So please conclude both the webinars, because we did not have time to conclude the last webinar because this was starting. So without conclusion of last webinar, we jumped into this room, next link. So please, Dr. B.K. Agnihotri ji, please conclude.
Thank you, sir. Thank you, Pawan Sharma ji. My revered honor to all senior persons like our Vishnu Sharma ji. It is well said that Vayuna yat niyante tat varshanti megavat. Dr. Pawan Sharma made all efforts to carry us to Singapore. And so in the return journey, these three young chaps are also might be feeling themselves in India. Today, I would like to take my time to react upon today's presentation done by these three young chaps. Really, it's wonderful.
Not only three, sir. First these three, then those five.
Okay, sir, all the five one. Really, these people are serving for Ayurveda, for yoga, beyond the boundaries of our country. And as far as the Maitri is concerned, if it is Maitri, then what I learned in our ancient ancestors like Apala, Mandata, then Gargi and Maitri, of course, Vidyotama. So in that way, it reflects back that the Maitri is something who is full of knowledge and intelligence. And when it is being supported with Nagar, that is again the all cleverness. So what a wonderful fluency in their presentation. And she really is struggling a lot. And when I came to know that she simply became way back in 2009, she's the youngest chap, and she's really serving beyond our country. Our few students are also there in Singapore and in Switzerland also. So well done. Your approach is wonderful, and really it's a pleasure that now this is the torch of carrying on and on beyond our country. Moreover, we are quite sure that Government of India will see the interest that as it is promoting Ayurveda in India, beyond India, definitely the day will come, then we will be recognized. And in London, there is I have the college, Anna Malta is also doing a lot in US, so all that, it is very good. Now, you people really touched me. You people just served for Ayurveda. I come to comment upon Kuldeep sir. Kuldeep is not only Kuldeep, it is Hindudeep. He is making all efforts for India. What he told that yoga has become more and more popular simply because it is not needing a lot of pharmacopoeia, while Ayurveda needs pharmacopoeia. So as far as the pharmacopoeia is concerned, yoga needs simply salt, simply for the gajikarni, or sometimes shankpachalan only, this pure ghee, etc. So yoga is been catching much more attention, and he is framing so many courses, as he told, simply because he is planning to give its essence to each and every person in the reference of Purusham Vikche. He is trying to make palatable the concept of yoga as per the person, as per the needy person. So he is making all efforts, and he is my Hindudeep. Now this is the third one, Risha Sharma. It seems that Risha is also having his dynasty from the Rishis. Because it is not very easy to put his name Risha. It may be Richa again from Vedas. So Risha is my. I came to know that she is from SKT College, Muzaffarnagar. Swami Kalyan, though you are just adjacent to me. I have just given you the say in chat box that we are from Haridwar Rishikul. So
Yes, sir, I
it's
noticed.
close
Thank
to me.
you.
You are really great. And you completed some diploma from Chandigarh also, Sri Krishna
Yes.
the college also. So we had been there in.
It's a naturopathic organization. Not
Your fluency in English is a point of jealous.
Thank you, sir.
You make the person jealous. What a wonderful! And I came to know that English proficiency and fluency is a must when you are interested to serve for any cause. It may be Ayurveda, it may be yoga, away from your country. So you really touched all these areas. Especially, I am a person of preventive health, so mental health is always there. This is the sector which has been covered not only by Ayurveda but also by yoga.
Yeah.
So the mental health can provide goodness and say wellness to the even cancer persons, to the anxiety person, depression person, and anything. So apart from your all working when you are in dire need of the medicines, you can supplement all do's and don'ts described in Sadvrata. So a lot of our very senior teacher, Professor Vinod Upadhyay, is making so many medicines available to the foreign countries in a form of the say food supplement. So as long there is a barricading, not getting the seeds or something which is not allowed to the foreign country, you are making all efforts and you are serving yoga and Ayurveda like anything. We have got proud of you. God bless you. You all is doing a lot. Whenever you come India or Uttar Pradesh, or it will be my pleasure if you visit us.
Thank
So
you
kind
so
of.
much,
Thank
sir.
you.
Thank you, sir.
Thank you. Thank you, Pawan Sharma ji.
Excellent.
Thank you.
Very nice, sir. Very nice conclusion.
Really, they trust me today. They trust me.
I would like to welcome from Canada, Dr. Harish Verma,
Okay.
President of Ayurveda Association. He has recently joined. Dr. Harish Verma ji, would you like to say something? He directly joined. He is from Canada, and he is principal of Ayurvedic College there and president of Ayurvedic Association in Canada. Sir, Dr. Harish Verma ji, am I audible to you, sir? I hope we don't. Dr. Harish Verma ji. Hari Om, Hari Om. So, sir, please give me 2 minutes only. Tomorrow on 23rd, our GCP webinar is there, where we are announcing good clinical practices curriculum and course tomorrow. 25th World Pharmacist Day is there. So from Sri Lanka, Dr. Vijayantmala and other speaker from India will guide us the role and career of pharmacist in Ayush. Next, on 26th, World Contraception Day is there. So on World Contraception Day, 4 female guides will enlighten the path of contraception through Ayush. On 27th, the Deaf Day is there, World Deaf Day. So we have invited ENT expert, Professor of ENT, Shalakya Vibhag, and they will guide us how to treat deafness with Ayurveda. On 29th, in Lifestyle Disorder Series, for heart care, we have invited AYUSH experts for heart care, holistic heart care through AYUSH. So this is our September program. Please join
Thank
with
you,
us.
sir.
Instead of inviting thousands of people, we have decided to make a small group meetings. So, but continuation, because real Ayurveda is for every second, not for one day. So we will be reminding our society and world that we are here to celebrate every day with Ayurveda. Thank you, thank you, thank you. Please join every day Ayurveda. Thank you.
Excellent job. Excellent
Thank you
job.
so much, sir. Thank
Hari
you.
Om, Hari Om, Hari Om. Thank you,
Namaskar,
Maitri. Thank you.
Thank you, sir. Thank you.
Thank you,
sir.
all the
Thank you for
seniors, and
today.
it's a real pleasure to be in the presence of all the dignitaries and professors. And since there are so many professors, I would request, to promote the education in Ayurveda on the international level, because that is something I'm very passionate about. So that's why a personal request to all of you.
If you want to start any course of Ayurveda in your country, we are ready to join. We are ready to plan that. Don't worry. Our senior professors, right from the senior professors to organizers, will organize that. But the publicity in local area is of your duty.
That's
So do
great,
it.
sir.
Yes,
Yep.
do it well. We are with you. Right from the legal, Dr. Khatavkar sir. Right from the clinical, Dr. Vishnu Prasad Sharma sir. Everybody is here to help you. Don't worry, you are alone in Singapore. We are
Yeah.
with you.
Thank you so much, sir. It means a lot to have the blessings from all of you, as well as such a, unconditional support. Like, you have made us feel really, I think I can speak on behalf of all three speakers, that you have made us feel really welcome over here, and not made us feel at all amateurs despite our age or whatever experience we are gaining. So thank you so much for such unconditional love and humility from your side.
Thank you. Thank you. Now I would like to request Professor Dr. Harish Verma ji to say something from Canada.
Namaskar to everyone. एक सेकंड
Welcome, 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 sir. Welcome.
एक
Swagatam.
सेकंड में
Voice is coming, sir.
So yes, sorry, it was disconnected. So am I audible now?
Yes, sir.
हाँ, शर्मा जी, मैं आज एक आपके प्लेटफॉर्म पे रिक्वेस्ट करना चाहता हूँ सभी लोगों को कि इंटरनेशनली अगर आयुर्वेदा को रिकॉग्नाइज करवाना है तो थोड़ा सा भारत में काम करें आप लोग। हम लोग बाहर बैठे हैं, अमेरिका में, कनाडा में, यूके, यूरोप, सब जगह। सबसे बड़ी दिक्कत क्या है, हमारे पास कोई करिकुलम तैयार नहीं है कि आयुर्वेदिक प्रैक्टिशनर बनने के लिए वेस्ट में क्या करिकुलम होना चाहिए, क्या सिलेबस होना चाहिए। और ये 2010 से हम रेगुलर रिक्वेस्ट भेज रहे हैं गवर्नमेंट ऑफ इंडिया। इतना टाइम ले रहे हैं, 11 साल, एक 2 पेज का करिकुलम तैयार नहीं हुआ इनसे। बातें करते हैं रिकॉग्निशन की कि इंटरनेशनली रिकॉग्निशन हो, क्या करते हैं ये लोग। आप प्रेशर डालिए अपने अपने तरीके से। जब तक सिलेबस ही नहीं है कोई, हम कैसे प्रैक्टिशनर बनाएंगे, कैसे पढ़ाएंगे, कैसे कॉलेजेस खोलेंगे, कैसे इंस्टीट्यूशन खोलेंगी, कैसे रिकॉग्निशन होगी। मैंने 3 बार कैनेडियन गवर्नमेंट को अप्रोच किया, जैसे व्हाट इज द करिकुलम, क्या पढ़ाना है आप लोगों ने, बताइए। है ही नहीं। सब लोग अपने अपने करिकुलम लेके बैठे हैं। कोई 36 घंटे का कोर्स करा रहा है, कोई 200 घंटे का करा रहा है, कोई 500 घंटे का करा रहा है, कोई 1000 घंटे का करा रहा है। क्या है? तो सर आपसे बहुत बहुत रिक्वेस्ट है कि आप गवर्नमेंट ऑफ इंडिया को लिखे, आपने इतना बड़ा काम किया है, लेकिन हम लोगों की डायरेक्शन सही नहीं है, वी आर डायरेक्शनलेस। इसके बिना करे मतलब एक सिलेबस के बिना हम कैसे अप्रोच करें गवर्नमेंट को, क्योंकि अगर लोकल लोगों को किसी भी कंट्री में इन्वॉल्व करना है, सबसे इंपॉर्टेंट है कि आपका सिलेबस क्या है। सिलेबस के आधार पे एजुकेशन होगी, एजुकेशन के आधार पे उनका स्कोप ऑफ प्रैक्टिस हो। अब आउटसाइड इंडिया अगर हम वही संस्कृत के सारा संस्कृत एबीसी पढ़ाने लगेंगे, वो पॉसिबल नहीं है। अब इंग्लिश में अवेलेबल है, इंग्लिश इज ए इंटरनेशनल लैंग्वेज, हम इंग्लिश में सब कुछ पढ़ाएं। और हमें ये देखना है कि आयुर्वेदिक प्रैक्टिशनर बनने के लिए क्या क्या चीज है, हम लोगों को तय करना चाहिए, स्कोप ऑफ प्रैक्टिस उसी से बने। तो ये थोड़ा सा अपने अपने लेवल पे कन्विंस करिए मिनिस्टर्स को, हम भी कर रहे हैं। मैं यहाँ पर रेगुलर हम लोग आयुर्वेदा लेक्चर सीरीज चला रहे हैं, उसमें हाई कमिश्नर काउंसिलेट जनरल ऑफ इंडिया, उधर से आयुष के लोगों को मैंने इन्वॉल्व किया हुआ है, लेकिन तो मतलब कोई रिजल्ट नहीं आ रहा।
नहीं,
Sir, I
बहुत
would
सही
like
बात
to,
की सर,
I would
आपने
like
बहुत ही
to,
सही
I
बात
would like to answer this question. Shall I?
की। यस,
Namaste, namaste, Harish Verma, sir. Dr. Harish Verma ji from Canada. I am Advocate Dr. Khatawkar from Bombay. I am Vaidya, BMS, and having legal qualification. And I have been fighting with various state government and central government for the recognition of Ayurveda. As you have raised the question of syllabus, sir, I would like to give a ready reckoner on a website of Central Council of Indian Medicine. That syllabus is very much available. You can go and just download. Now that Central Council of Indian Medicine has
Dissolved.
changed his name as a National Commission of Indian Systems of Medicine, but that website still exists. So you can go on that website and you can download the syllabus. All BMS as well as all years and as well as postgraduate in all the branches. The question remains with you that whether that syllabus you will be adopting to the same because it will require more expertise, teachers from the but initially you can take the some of the points from that what to do, and you should approach to your government health department and request them to
ये एक
start
मिनट
such a
no,
curriculum.
my
It will take, it is very
understanding
tough.
is this. My understanding is this, that Dr. Harish Verma is trying to take some syllabus, official syllabus from Government of India, which can be recognized and standardized by all the countries, not by one country. His question was that somebody is conducting course of 36 hours, and somebody is conducting course of 1000 hours. So
Yes.
standardization, and
yes
I'm also going to Delhi just day after tomorrow, and I hope I will meet Kotecha and Katoch and Sri all.
and
Definitely this point will be raised.
So
शर्मा
that's
जी,
the thing, like not only
शर्मा
in
जी,
Ayurveda, but yoga also. Like Dr. Kuldeep, he is a master's and a PhD, but like most of the trainers out there have a 200 hours or a 500 hours certification. But if our government doesn't make active efforts, I'm not talking about establishing universities of Ayurveda and yoga, but there are already existing universities. Like Harvard is trying to coming up with its own course in Ayurveda. But where are the stakeholders? Who are the real doctors? From where the science is coming from? We as stakeholders are absent from the whole picture. So why is that not being presented to the university, not establishing the universities, but Ayurveda offered as a course in these colleges so that it can be standardized and made a mainstream subject in these colleges? I think that would be something that would take us forward a lot and, like make the standardized practice across the world, because education is the basis of where we move on.
When they can patent so many herbs that we use for years and sell them as their own after doing the patents, I think courses should very well be available in all those countries.
There are few
That's the much
institutes
needed
in Ayurveda.
recognition.
There are few institutes in India which offer an curriculum Bachelor of Yogic Sciences, Yoga and Naturopathy. I know these 6 to 7 institutes are there. If you want details, you can contact me. But these are only 6 to 7 institutes. Number one. Number two, up till now, the Ayurveda was used to be governed with the Indian systems of medicine and health since 1950s. Then afterwards, homeopathy was separated and only Indian systems of medicine was kept. And since 2014, a new term was coined Ayush, where Ayurveda, Yoga, Naturopathy, Unani, Siddha, and Homeopathy all were again united. So here again Yoga and Naturopathy is there. And I know there are 6 to 7 institutes in India who are conducting the course of Bachelor of Yoga and Naturopathy Science, BYNS something. 6 to 7 institutes. You can search on website also. Thank you.
Thank you, sir.
So, Sharma ji,
Yes.
one more minute. I have shared the screen. Is it visible?
Yes, sir.
So this benchmark for training in Ayurveda, this is a document designed by WHO. It is already available on the net. And in this document, there is a curriculum for becoming an Ayurveda practitioner. It is already there, but this is not working in West. We are trying to update it. It is so. जो पहले अपने डॉक्टर साहब ने बताया था कि अपना अपना कोर्स कर सकते हैं, वो तो लोग कर ही रहे हैं. कोई 200 घंटे का कोई, there should be, as you rightly mentioned sir, there should be a recognized course. हम लोगों ने यूके में काफी काम किया था 95 से 2000. एक डॉक्यूमेंट जनरेट हुआ था ये वाला, मैं आपके साथ शेयर करूंगा. इसका ये पूरी बुक है रेगुलेशंस के ऊपर, हर्बल मेडिसिन रेगुलेशन. इसमें आयुर्वेदा भी हम लोगों ने डलवाया. अभी यूएस और यूके में we are trying our best to get Ayurveda regulated by various provincial governments. लेकिन वहाँ सबसे बड़ी प्रॉब्लम ये है कि कोई भी एक स्टैंडर्डाइज हमारा कोर्स नहीं है. जब तक कोर्स स्टैंडर्डाइज नहीं होगा तो स्कोप ऑफ प्रैक्टिस डिफाइन नहीं होगा कि हमारे जो वैद्य निकलेंगे वो क्या कर सकते हैं, क्या नहीं कर सकते. हालांकि जो प्रोडक्ट्स की रेगुलेशंस हैं, हर्बल प्रोडक्ट्स की रेगुलेशंस, ये ऑलमोस्ट ऑल ओवर वर्ल्ड रेगुलेट हो चुकी है. देयर आर रेगुलेशंस अबाउट द प्रोडक्ट्स, लेकिन प्रैक्टिस की रेगुलेशंस वो अभी नहीं हुई है. वो सारा डिपेंड करता है कोर्स के ऊपर कि आप लोगों पढ़ा क्या रहे हैं. आई एम नॉट टॉकिंग ऑफ BMS कोर्स, MD, PhD, व्हाटएवर इज अवेलेबल इन इंडिया. मैं आउटसाइड इंडिया की बात कर रहा हूँ कि अगर मासिस को हमने आयुर्वेदिक प्रैक्टिशनर बनाना है, 15-20 हजार प्रैक्टिशनर अगर कनाडा में, यूएस में बनाने हैं, उनके लिए कोर्स क्या होना चाहिए? दैट शुड बी यूनिवर्सल. और उसकी कोई ना कोई रिकॉग्निशन आयुष से भी होनी चाहिए. बिकॉज कनाडा में हमने देखा है, यहाँ पर TCM, ट्रेडिशनल चाइनीज मेडिसिन, इट इज रेगुलेटेड प्रोफेशन. उन लोगों ने यहाँ के गवर्नमेंट के ऑफिशियल्स को वो बीजिंग लेके गए, वहां पर उन्होंने सारा TCM का सिस्टम दिखाया. देन दे गॉट इट रेगुलेटेड इन कनाडा. ऑन सिमिलर पैटर्न किसी भी कंट्री में अगर किसी ने आयुर्वेदा को रेगुलेट करवाना है, उसको इंडिया के साथ लिंक करना पड़ेगा. हमें इंडिया का आयुर्वेदा का इंफ्रास्ट्रक्चर दिखाना पड़ेगा वहां की गवर्नमेंट. This is how we can get it regulated. तो इसके बारे में हम लोग आगे भी बात करेंगे. I have taken too much time. Thank you very much, sir. Thank you.
Thank you, sir.
Over to Sharma ji. Over to you.
Yes, sir.
Sharma ji.
Very nice and very nice interaction today.
हाँ,
We are with you. You are not
even
alone
Singapore में-
in Canada or Singapore.
Yeah, even in Singapore, if anybody wants to get it regulated, they need a curriculum. वहाँ की गवर्नमेंट को अप्रोच करने के लिए, और ये सारा कुछ बिकॉज जो मेरी इंफॉर्मेशन है, मेरे कुछ इंडियन गवर्नमेंट में कुछ मिनिस्टर्स मेरे दोस्त हैं, उनसे जब बात होती है, they all say कि आयुर्वेदा इज वेरी क्लोज टू हार्ट ऑफ प्राइम मिनिस्टर. मोदी जी चाहते हैं कि ये आयुर्वेदा योगा की तरह यूएन में रिकॉग्नाइज हो और पूरे वर्ल्ड में रिकॉग्नाइज हो, लेकिन उसको रिकॉग्नाइज करने का फर्स्ट तरीका ये है कि हम एक सिलेबस के ऊपर पहले फोकस करें, उस पर एक कंसेंसस बने कि ये सिलेबस होना चाहिए. एंड वी हैव टू बी वेरी केयरफुल. आई एम ऑफ द ओपिनियन दैट आवर बीएमएस कोर्स शुड नॉट बी डाइल्यूटेड. वो वैसे ही रहना चाहिए. बिना बीएमएस कोर्स के डाइल्यूशन के हमें एक सिलेबस के ऊपर कंसेंसस बनाना पड़ेगा कि ये सिलेबस जो है आयुर्वेदिक प्रैक्टिशनर वेस्ट में कैसे होने चाहिए, उनको क्या क्या सिखा सकते हैं. फिर एडवांस स्टडी के लिए वही प्रैक्टिशनर इंडिया में आके अपनी एडवांस स्टडीज कर सकते हैं. दे कैन डू बीएमएस, एमडी, पीएचडी, व्हाटएवर दे वांट. दैट विल बी एडवांसमेंट. बट एक मिनिमम कोर्स के ऊपर हमें कंसेंसस बनाना होगा कि ये जो सिंगल हर्ब्स हैं, मल्टी हर्ब प्रेपरेशंस हैं, क्योंकि जैसा मैंने बताया कि प्रोडक्ट्स के ऊपर रेगुलेशन ऑलरेडी बने हुए हैं. किसी भी हर्बल प्रोडक्ट में मेटल्स आर नॉट अलाउड, खास करके जो हैवी मेटल्स हैं दे आर नॉट अलाउड. वहाँ उसमें पेस्टिसाइड, केमिकल्स, ये वो सब कुछ नहीं होना चाहिए. वो सब कुछ हर कंट्री में बना हुआ है, लेकिन जो प्रैक्टिस है उसके ऊपर रेगुलेशन नहीं है. वो हमें काम करना.
We are with you, sir. Please guide us what we have to do with India from India. Definitely, we have a good team, pan-India team, right from Jammu and Kashmir, director, ex-director to Kerala director are with us. Please guide us what is to be done, and we are ready to support. We are ready to support.
Thank you.
Thank you. Thank you.
Thank
Thank
you,
you
sir.
all. Thank you very much. All speakers, expert of the dais, expert on the dais. Thank you very much, sir. Thank you very much.
Thank you, sir.
Meeting
Thank
you
you very
tomorrow.
much.
Thank you and good night,
Hari Om.
everyone.
Hari Om.
Good night. Hari Om.